It's the same stuff you talk about, Josh, is, get below their level of the eye. Like, don't stand over the top of them. Look at your body language. Like, you're talking to them like a human being versus being dominant of the conversation. Like, I try to get patients to give me feedback all the time. Like, would you like to be dry needled today, or would you like cupping today? Like, or I could do ART, like, or we could scrape. Like, what do you think? I think just anytime you can give them the option to, and I think the research supports this as well, is you're not dominating the conversation. It's a team effort. We're doing this together, So
Yeah.
I think that's helpful in building rapport.
Just out of curiosity, Ed, since you have so many programs you've gone through, like you're an ATC, Chiro, RN, do you feel that any of those, and obviously you haven't attended all the schools for all of those professions, but was anybody more focused on like the communication side of things than others? Like I always wonder about mental health providers, like their whole job is communication, right? That's their treatment method.
Right.
But
I would say nursing by far, like that was the biggest thing I took out of the nursing program was the compassion, the understanding, the teaching of the patient, instead of like a teach back method, they always emphasize like, see one, teach one, or see one, do one, teach one, where you're making them not only perform it, but teach you back. And so it was like night and day. But of course, I went to chiro school, 1,000 years ago. Might be different now.
how long ago did you go to nursing school?
That was more recent. So I only graduated about 18 months ago.
Okay.
Yeah.
Yeah, I wonder if it went through like cycles, or like if the 18 months ago education was based on, previous failures or ways people that got into trouble, etc.
Yeah, I don't think so. I think it's just the nursing compassion. It's just the way, which is kind of ingrained in the nurse,
Yeah, a little Florence Nightingale action there.
Yep. Oh, flow.
Yeah, I think that's wonderful. We I graduated in 2017, and there was definitely not like a class on that, but Dwayne's shaking his head too. Like we definitely discussed like in doing like patient exams or like doing the female male sensitive exams. They're like, you should say this, you should say that. Like they kind of, but it was one day, one time. There was no grading on it. Like you could have walked in and just been rude and you would have still passed as long as you did the exam correctly. So nobody really focused on that.
Yeah, that is interesting. And I've looked at some of that research around malpractice too, and so much of it centers around surgeons. And then in the same research, you'll often see like in the same hospital, same setting, same patient, nurses almost get sued never, and the surgeon will get sued a lot. And it's like, is it simply a communication thing,
I think it's the empathy thing. I think it's, the rush thing. It's who you spend more time with too, typically, all my clinicals, you'd sit on a ward and you might see the physician like 3 minutes on a shift. And it's usually to yell at you for something. Like it was like, but you're the one that's in there feeding the patient. You're like turning the patient. You're making sure they're comfortable. They ring the bell. They need something. It's the nurse or the nurse assistant that's going in there. They never see in a hospitalization. You never see the doctor. So it's like, who are you spending all the time with? Who are you having the conversations with? Who's having the conversations with your family? Like, especially in like the hospice setting, like that was the most. Like we never saw the physician, never, ever, 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 ever. Usually he called stuff in. Like it was always, we were dealing with the families, we were dealing with everything else. So it's just a different, it was interesting going through, chiro school. You're the doctor, you're the one that's making all these decisions. And then you get retrained almost from the other side. And I'm like, God, I wish I really would have gotten a lot of this. Back in the day.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up.